Kapugaiga Seongapa. My name is Flora Warrior. I'm the Deputy Chair and a Director on Cape and Torres Health Commissioning Incorporated, which is a community-led commissioning body set up to essentially make funding decisions for the Cape and Torres region around health services and health service delivery. So my background is I'm from Mabuiag Island and a traditional owner from Mabuiag for the Gamugal people of Mabuiag, and my clan is the Dugong Crocodile people, Dangal Kadal, and our language is Kalalagawya. And we also acknowledge on Mabuiag that it is part of the great ancient language that goes up from Cape York into the Torres Strait, called the Pamanyungan ancient language group. We also have shared songlines with the Cape York communities as well that we acknowledge. I'm quite passionate about health reform, especially around the gaps that we see in the Torres Strait, particularly in the Outer Island region, because a lot of the services are quite TI-centric, meaning a lot of it are based around Thursday Island, and a lot of the decision-making around health service delivery is around Thursday Island itself and based on the context around Thursday Island. And so one example of that is, I can give a real life experience example where we out at Mabuiag have a visiting doctor every 2 weeks. Hopefully it's 2 weeks if the weather's good, because they arrive by helicopter or plane for like half a day, and then they take off again in the afternoon. And hopefully you're seen in that time. And what happened in this particular case was when the doctor arrived, there were a lot of people lined up to see the doctor. And because there's a lot of people there, and it became apparent that some people would miss out on consultations with the doctor that day. So we started triaging ourselves, as community people do. So I said to one auntie, you go first, because you're a chronic patient, you go first. And a mum with sick children, an uncle that never saw the doctor for a long time, and other people, I put them ahead of me on the queue so that they could be seen. And so that round I missed out. And I thought, well, the next 2 weeks, I'll just go and see the doctor again when they come around for the next visit. And so what happened was I turned up again and again missed out, because the same thing happened. And at that time I thought it would be great if the doctor alternated every service visit with an overnight stay, so that they could get through the backlog of people waiting to be seen.
Because you ended up actually not being able to wait for the next visit.
And so I waited for the next visit again. And so for the third time I showed up, and again the same thing happened, and some people missed out because the doctor had to leave. They had to be out by a certain time by helicopter. And I was one of those that missed out again. And shortly after that, I became very unwell with my condition, because it wasn't attended to. And I became very unwell and had to be medevaced out of the community to Thursday Island and eventually on to Cairns Hospital, where I had to receive urgent surgery for my issue. And one of the thoughts I had flying out on the helicopter during the medevac is, well, how much is this medevac costing the health system when the investment of just an overnight stay by the doctor would probably have made a big difference in the health cost that's used up by myself as a consumer. And so the second example I have is a community elder that set out by tinny in very rough weather to go to Thursday Island for emergency dental care. But when he got there, he was turned away at the counter and told, "Go home and come back tomorrow." It's really hard to say to an outer island, "Go home," when you turned up in a tinny in the open sea and you urgently need to be seen. So normally what happens is outer island people are put first and seen first. But in this case, he wasn't. He was in terrible pain. And because he didn't have money to stay on Thursday Island, he set out back to Mabuiag and didn't get back to Mabuiag until 9 o'clock at night. And the community was praying for him to get back safely because he was by himself. He was very unwell. He was in a lot of pain. And so what happened was family got together and contributed money for a light plane charter to get him off the island and try again to get seen for urgent dental care. At the time, we didn't have regular patient travel because the RPT flights were suspended at that time because of the CASA regulations, and we just happened to have one of the shortest airstrips in this country. And so while that was going on, we didn't have the flights, and that meant people had to travel by tinny to access health services on Thursday Island.